health aides often provide care for what is called the integumentary system of the body, that is, the skin, nails, and hair. Personal hygiene and grooming play an important role in maintaining the client's health and aiding in the healing process and the client's comfort. In this tape and our next, we'll talk about the procedures required to maintain client hygiene and cleanliness. In this tape, we'll review facts about the skin, talk about pressure sores, including their causes, their developmental stages, and how to care for them. We'll demonstrate the proper procedure for giving back rubs, changing the linens on both an unoccupied and occupied bed, applying ointment, changing dressings, and providing oral care for gums, teeth, and dentures. The skin serves many functions for the human body. It protects the organs, regulates body temperature, and works with the nervous system to sense touch, pressure, pain, heat, and cold. As people age, their skin changes. It loses elasticity and becomes drier, rougher, and wrinkled. This can be due to hygiene practices, nutrition, the effects of the sun, and the client's general state of health. The top layer of the skin flattens and the fatty layer becomes thin. As a result, the ears seem to protrude more and the nose appears longer. Hair loses its color and becomes thinner. Toenails become thicker and more difficult to cut. Unusual growths can occur on the skin. These are often called age spots and may appear on various parts of the body in different shapes and sizes. As a home health aide, you need to report any changes in these spots, such as changes in size, shape, or color, or any unusual discharges. A pressure sore is a breakdown in the skin. It is the result of reduced blood supply to the skin and the tissues beneath it. Pressure sores most often appear in the skin that covers a bony area, such as the hip, elbow, or heel. Pressure sores can become serious nursing problems. Deep sores may go all the way down to the bone. They present a serious risk of infection, as well as a painful wound that can make movement difficult. Pressure sores can result from several different factors. These include the overuse of soap, staying in the same position for too long, poor nutrition, prolonged skin contact with urine or other discharges, medical conditions such as diabetes, stroke, paralyzation, or circulatory problems, low humidity in the home, obesity, excessive thinness, friction to the skin from moving, and wrinkles on linens or braces that rub against a body part. Many of these conditions are preventable, especially if the home health aide provides proper care to the client. Pressure sores develop in 4 stages. In stage 1, the skin becomes red. In stage 2, a blister develops. The blister bursts in stage 3. In stage 4, the pressure sore is open, exposing the muscle, bone, or other vital structures. Proper care from the home health aide can help prevent or care for pressure sores. Follow the client's care plan for any special needs, such as applying a special device like an elbow pad or changing the client's position. Increase the amount of protein and calories in the diet, unless the client is obese. Use adult briefs if the client is incontinent, and apply a good skin barrier. Transfer the client with care. Avoid dragging skin against sheets. Change the client's position at least every 2 hours and keep the client mobile as much as possible. Use soap sparingly. Apply body lotion to keep the skin in good condition. Increase fluid in the diet. Avoid hot water when bathing the client. In addition to proper care, assistive devices can be used to prevent the development of pressure sores. These devices include an alternating air pressure mattress. This is used for clients who spend most of the day in bed. An egg crate mattress separates the sheets from the mattress. Be sure to use thin fitted sheets with this device. Heavy sheets will reduce its effectiveness. A gel foam cushion. Use this for clients who spend most of their time in wheelchairs. A bed cradle, which keeps the top linens off the client's legs. Elbow pads, to protect the elbows from friction with the bed linens. Heel pads, to shield the heels from such friction. An ankle elevator pad, which keeps the ankle and heel off the bed. And lamb's wool or sheepskin, which helps keep the skin moist. Artificial skin, such as duoderm or hydrocol, may also be used to treat pressure sores. These contain ingredients that assist in healing sores. The nurse applies this product with a dressing and changes it as necessary, usually after 5 to 10 days. It is okay to place the client in the tub or shower with this dressing on. Back rubs can also help prevent pressure sores. Back rubs increase the blood circulation in the client's back. Help prevent skin breakdown. Give the aide an opportunity to observe the skin for signs of pressure sores. And give comfort and relaxation to the client. For this procedure, you'll need lotion and a small towel. Gather this equipment and wash your hands. Tell the client what you plan to do. Provide for privacy. Position the client on the back or side. Place a small amount of lotion on your hands. Rub your hands together to warm the lotion. Starting at the base of the spine, rub the skin up the center of the back, working toward the neck. Use both hands in one long stroke. When you reach the neck, come down the sides of the back. At the base of the spine, repeat the procedure. Repeat it several times. If necessary, add more lotion. The client may want you to rub in a spiral motion for several minutes. If the client's skin is fragile, rub very gently to avoid skin tears. When you have finished the back rub, remove excess lotion with the towel. Reposition the client. Return the lotion to its proper place and wash your hands. Document the back rub and note any signs of skin breakdown you may have observed. Replacing dirty and wrinkled bed linens with clean ones is important for the client's hygiene and comfort. Sheets should be changed whenever they are dirty, and no less than once a week. Changing a bed requires a top sheet, a fitted or flat bottom sheet, and pillowcases. A mattress pad, bedspread, and blanket may also be needed. Strip the bed of all soiled linens. Roll them up and place them in the laundry. Always carry soiled linens away from your clothing. Wear gloves if the linens are wet. Notice what linens are on the bed so you'll know what you need to replace. Blankets, mattress pads, and bedspreads do not need to be changed weekly unless they become soiled. Wash your hands. Gather the clean linens. Place the mattress pad on the bed and then apply the fitted sheet or flat sheet over it. If you are using a flat sheet, unfold it with the long fold at the center of the bed. Place the lower hemline even with the bottom of the mattress. If you're using a fitted sheet, stretch the corners around the mattress. Open the top sheet gently. Do not shake it. Starting at the head of the bed, miter the corner and tuck in that side of the sheet. Stay on the same side of the bed and place the top sheet over the bottom sheet, wrong side up. Place the hem even with the top edge of the mattress and the centerfold at the midline of the bed. Tuck in the top sheet at the foot of the bed and make a mitered corner. If the client uses a blanket, place it on top of the sheet. Pull the sheet about 12 inches from the headboard. Tuck the top sheet and blanket in at the foot of the bed and miter the corner. Walk over to the opposite side of the bed and repeat these procedures. Now place the bedspread on the bed. Place the pillow on the bed to apply the pillowcase. Do not put it under your chin. Position the pillows on the bed with the open end away from the door. Wash your hands. Document that clean linens were applied to the bed. If it is part of your duties, launder the soiled linens. This is the accepted procedure for making a bed, but clients may prefer their beds be made in a particular way. Try to follow their directions where possible. It is also important to know how to change the linens on an occupied bed. Clients who cannot get out of bed still need to have their linens changed regularly. For this procedure, you'll need a fitted or flat bottom sheet, an extra flat sheet or draw sheet if needed to turn the client, pillowcases, and a large plastic bag for soiled linens. Wash your hands and assemble the clean linens. It's a good idea to stack the linens in the order you will use them. Place them by the bed on a clean chair or table. Tell the client what you plan to do and provide for privacy. Loosen the bedding from under the mattress by lifting the mattress with one hand as you pull out the bedding with the other hand. Remove the top covers one at a time. Leave the top sheet covering the client to prevent chilling and afford privacy. If the client is in a twin bed with side rails, raise the rails to protect the client from falling out of bed. If there are no side rails, place 2 straight chairs against one side of the bed. Instruct the client to turn to the side facing the chairs or rails and assist the client in moving near that edge of the bed. Stand at the other side of the bed, facing the client's back. Roll or fan fold the soiled bottom sheet to the center of the bed beside the client's back. Fold the clean bottom sheet lengthwise and place the fold at the center of the bed. Fan fold half the clean sheet next to the soiled sheet. Tuck the other half under the mattress. Tuck from the top or head of the bed and move toward the foot of the bed. Bring the chairs to the other side of the bed for the client's safety, or raise the rails on that side. Remove the soiled sheet from the other side of the bed. Place soiled linens into the plastic bag. Pull the clean sheet across the bed and tuck it under the mattress. Tuck the sheet in and pull out any wrinkles. Turn the client onto their back in the center of the bed. Place a clean top sheet over the soiled top sheet. Then, slide the soiled sheet out from under the clean sheet. Have the client hold the fresh top sheet in place. Place the soiled top sheet into the plastic bag. Unfold the blanket and bedspread and place them over the top sheet. Tuck in the bottoms of the sheet and blanket at the foot of the bed. Miter the two corners. Leave extra room for foot and toe movement. Change the pillowcases and replace the pillows under the client. Be sure the open end of the pillow is facing the window or wall. Make sure the client is comfortable and in good body alignment. Remove the plastic bag with the soiled linens. Wash your hands and document that clean linens have been applied to the bed. Some clients have skin conditions that require the use of ointments on unopened areas of the skin. To apply these, you'll need the correct ointment and disposable gloves. First, carefully read the care plan. Check the name of the ointment and where it is to be applied. Double-check the name on the care plan and the name on the ointment to make sure you have the right product. Wash your hands. Put on disposable gloves to prevent the ointment from absorbing into your own skin. Assist the client to expose the part of the body to which the ointment will be applied. Read the directions carefully. Some ointments require only a thin layer. Others require a heavy coat. Open the cap of the ointment and squeeze it out onto your glove. Then, apply to the client's body. Remove the gloves and dispose of them properly. Wash your hands. Return the ointment to its proper storage place. Document the name of the ointment and where and when you applied it. Changing dressings is essential for helping skin heal and avoiding infection. For this procedure, you will need disposable gloves, a clean gauze pad, tape, a pair of bandage scissors, and a plastic bag. Assemble these items. Gauze pads and tape come in various sizes, so be sure to get the ones you need. Note that bandage scissors have a blunt end. This is to prevent cutting the client's skin when removing a dressing. Wash your hands. If you know you will need tape, cut it before applying the gloves. Otherwise, the tape will stick to the gloves. Place the cut pieces where you will be changing the dressing. Then put on the gloves. Tell the client what you are about to do. Position the client so the area of the dressing is accessible. Remove the old dressing. Note the color, the amount of drainage, and the condition of the surrounding skin. Note if there is any unusual odor from the dressing or wound. Place the soiled dressing in the plastic bag. Open the package of gauze pads. It is important to keep the pads as clean as possible. Touch only one end of the pad and be careful not to let the dressing touch the bed linens or the client's clothing. Apply the pad to the client's skin. Remove your gloves and apply the pre-cut tape. Wash your hands and return all equipment to its proper place. Document that the dressing was changed and note the amount and color of any drainage. Good oral care is a critical part of staying healthy. Clients can contract infections, develop halitosis, also called bad breath, lose their appetite, incur tooth decay, and develop other dental problems as a result of poor oral hygiene. Toothettes and lemon glycerin swabs are used to keep the teeth and gums healthy, refresh the client's mouth, and improve appetite. This technique is often done every 2 hours for clients who are terminally ill or in a coma. Wash your hands and apply disposable gloves. Place small towels or paper towels under the client's chin. Dip the toothettes into water or mouthwash. Lemon glycerin swabs can be placed directly from the package into the client's mouth. Insert into the mouth and swab the gums, teeth, and tongue. Swab the mouth using slight pressure. If necessary, repeat with a clean swab. Apply pleasant-tasting lip lubricant to the lips. Place the used swabs in paper towels. Remove your gloves. Dispose of gloves, paper towels, and used swabs. Wash your hands. Document the completion of the task and any abnormal observations. Some clients need assistance in brushing their teeth. This should be done regularly to keep the teeth and gums healthy and refresh the client's mouth. This procedure requires disposable gloves, a towel, a toothbrush, toothpaste, mouthwash, a small glass or cup, a small bowl or emesis basin, and either tissues, a damp washcloth, or paper towels. Wash your hands and apply the gloves. Tell the client what you plan to do and get the client into a sitting position. Lying flat for this procedure increases the chance of the client aspirating, that is, having foreign material enter the lungs. Place a towel over the client's chest and under the chin. Moisten the toothbrush and apply a small amount of toothpaste. Let the client brush their teeth, if possible. If not, carefully brush the client's teeth. Be sure to apply slight pressure to the teeth and gums. You need to create friction to remove debris and plaque. Give the client a glass of water and instruct the client to rinse well. Hold the bowl or basin underneath the client's chin and have the client